Hello and welcome to today's video. Topic for the day is explaining uncertainty in treatment options. Uncertainty while discussing treatment options is something which every clinician comes across in their clinic on a daily basis. Advice given to patients is mostly based on best current evidence, but sometimes this needs to be tailor-made and a clinician needs to have a frank discussion about the various risks, benefits, and uncertainty around it. Let's discuss more about this by taking this example of a 55-year-old female who has recently undergone surgery for breast cancer. She reluctantly asks in the clinic if she needs chemotherapy or additional treatments, and also categorically mentions that she feels not very keen as she is scared of the potential side effects. Usually, while discussing these cases, using a graphical or pictorial representation is quite useful. As you see on the screen here, the various dots here represent about 100 cases of breast cancer who have been treated on the same lines of surgery as the lady in the case. From a sample size of 100 patients, there is a 46% chance for survival at 10 years with surgery alone. The uncertainty arises on the fact that no one knows whether this patient would be amongst the 46% survivors or would be amongst the 48% cases who would lose their life because of breast cancer. So to further improve survival, there are additional treatment options that can be discussed. For example, as depicted here, there is a potential 13.6% additional benefit with chemotherapy if added to this patient's treatment plan. This means that the number of survivors basically increases by 1/3 if chemotherapy is given in addition to surgery. But again, there is uncertainty whether this particular chemotherapy will work for my patient or not. Further, with more additional treatment options, there is a potential of increasing the survival to about 79% at 10 years. Again, it is difficult to predict whether my patient would be in the 79% or the remaining 21% who would not survive. The question is it worth taking a chance with the above uncertainty? It possibly is worth trying, but there would be uncertainty around certain treatment options. Let's say, for example, in the case of bisphosphonates, the additional benefit is only in the range of 3%. Let's say if this patient has some contraindication or certain risks which would make bisphosphonate treatment highly susceptible to causing side effects, I would possibly not consider this treatment in my patient. Hence the uncertainty around it. To summarize, uncertainty is difficult to explain, and it definitely adds to a service user's dilemma while taking an informed decision about his or her treatment options. Uncertainty doesn't mean that it's an admission of defeat while discussing a patient's treatment options. It means that there is uncertainty that exists around the management plan, and this will help progress research to make treatments better and safer.